So here's this very pretty young woman. I was stressed, told her to wait for me soon.
So you said you send me
back.
Yes.
You guys, you have to pay me for this.
Okay.
Alright, now bye.
So, are you ready for your 43 questions? Okay, what's your name?
My name is Dr. Chukwu, Amarachi, please.
Okay, what rotation are you on currently?
Internal medicine.
Where did you do medical school?
I trained in Ebonyi State University.
Did you take any gap year after secondary school?
That would be the year I did my pre-degree because I graduated 2014 and gained admission 2015. So I took a year to do pre-degree before I got into medical school.
Okay. What specialty did you think you'd get into on the first day of medical school?
Actually, I had none in mind at the time. Well, as at 300 level, I felt I was going to do family medicine, I swear. But when I got into clinicals, that changed. Yeah. Well, as at A1, and I had nothing in mind.
Okay. So what specialty are you likely to get into now?
Keeping view pediatrics. Keeping view.
Okay. Are there any specialties you think are not for you?
That would be, let's say, I don't know, dermatology.
Okay.
Definitely not for me. I don't understand what they do there. I try, but it's not working. That would be dermatology.
So describe your med school journey in 3 words.
Yeah, it was a beautiful one. It had its ups and downs, but in all, it was a beautiful experience.
Okay. So do you consider yourself an introvert or an extrovert?
Well, I'm neither here nor there. It depends on my mood. But I think I'm more of an extrovert. But there are times I, keep to myself.
Okay. So are you a day or night reader?
Well, that depends too. If I have lots of things to read, like my academic workload is up there, I'm both a day and a night reader. And if I don't, I could just do day, or because lately I sleep late, I do night.
Okay. So what event stood out for you in med school?
What event? We have my final year week. Yeah, it was. I was thrilled. Like the whole week, I was all out to have fun, and I did have fun. Yeah, that event was superb for me. Yeah.
What motivated you to pursue a career in medicine?
Well, then you're in science. They say medicine is the goal. You're in arts. They say law is the goal. It was just about studying a professional course as at then. And as young students who just left school, everybody was just all out to get into medicine, and eventually I did. But then I started to find purpose while studying medicine.
Okay. What is the best part of being a house officer?
Well, not all house officers will agree with this, but I would like being financially independent to an extent. The money is too much or is a lot, but you don't get to rely solely on your parents for everything now. To an extent, you can take care of your needs, like the very little ones, can take care of them, and even render helps to your siblings, your friends. So I would say the best part is the fact that I have see small change to one or two.
Okay.
Yeah.
What's the funniest moment on the job?
Funniest moment. I thought I don't know. Do you mean like fun or?
Yes. Like funny. Anything that happened maybe in the course of your training and you're like, oh, that's
as a house officer.
As a house officer.
Okay. I don't know if I'm supposed to say this out, but would I say funny or embarrassing?
Maybe now it should be funny, but then
funny, but then it was quite embarrassing. Being called to do things like cleaning, mopping the office of your consultants.
Really?
Names withheld.
Okay.
Yeah. It was funny because it was something people were even struggling to do. Let me not lie. The matron there was even trying to, take it all and do it all by herself. Since she was just trying to, get this person's attention, the consultant's attention. And it didn't make sense to me because this same matron, this nurse, would on a normal day not stand up from where she is to even see a patient. But then she was, struggling to be the one who is in charge of cleaning this consultant's office and making it, known to him that she's doing that, and then roping us into it as well. And then it was funny because I was like, I don't want to put the person's name. It was funny there because I was like, what?
It wasn't in your job description.
Yes, towards end. And then you calling this call and joining you. It was funny and then embarrassing at the same time.
Okay. So it wasn't like a punishment or...
No, it wasn't a punishment actually. It wasn't a punishment. It's just that I came, we were done with our rounds and then we went to the office and we felt okay, we were there to interact and get more information from our consultants and all. The next thing it's actually, and that was because the matron was already doing it, so it felt like as an African child that it was disrespectful that an elderly woman is bending down to mop and clean, and you Sisi just stand and then you're watching and maybe you're just raising your leg for her to sweep. Maybe it was Miss La, so you just had to do it because you don't want to appear
like a bad child,
something like that. It was funny but quite embarrassing.
So what was your favorite movie?
Favorite movie?
Yeah.
I do not have a favorite movie.
Do you even watch movies?
I watch movies actually, but I do not have a favorite movie. At times I just watch movies and then I forget about the name of the movie. It's funny when you start talking about it and mention maybe people that are in the movie. I'm like, okay, yeah, I think I've seen that movie. But I don't, keep track or try to remember the names of the movies I watch. And I do not have a favorite movie.
So who are your top 3 artists, musicians?
Mrs. Chukwu, I like Mrs. Chukwu a lot. Secular music, I like Davido. And then the third person would be I've seen Chidima.
Okay, okay. This is by the way though, Davido or Wizkid?
Davido, why am I?
Good answer.
Tetu BG.
Okay. What's your favorite dish?
Okay, as a proper Igbo girl, abacha.
Okay.
And then anything that has like meat, that's where meat, well pepper seasoned meat.
Nice.
Beef, yeah, something like that.
So this part is about
Suya,
okay. This part is about work.
Okay.
What has been the most challenging part of housemanship?
The most challenging part of housemanship has been relating with the people. You're usually not the same persons you do medical school with. You meet new persons and you just have to adjust and then try to understand people so you have a good working relationship with them. So it was quite challenging at first, getting to meet new people and understand this person, and so you could work well with them and not fall out. And then relating with the other health workers, the nurses, the men of sciences, the pharmacists. They are very good ones. They are people who are nice. I know there are some who are very rich. So you just have to, as much as possible, be patient so you don't lose your, you don't get angry and then lose it while at work. It won't be good.
Okay. So what's your typical day like as a house officer?
How do you, coming to work, staying around 4 or 5. Yeah.
So What skills do you think are essential as a house officer?
Okay. Well, as a house officer, I would always say you should apply yourself. I know as it is that now a lot of house officers already have what they want to do in mind. Japa, and for those, the few ones who want to stay back, they already, French life families, and then go into residency as soon as possible. And then for those who are out making money, they're already, doing other side hustles to make money. And those that do MO, they'll do MO by the side. But I'll say you should apply yourself. For every rotation, there are skills I feel they are very essential that you should get for every rotation. So for ORG, I feel you should know how to, carry out normal delivery. You should learn about everything, manual vacuum aspiration. You should be able to manage cases like, preeclampsia, and then cases like term labor, and what they call it again, ectopic pregnancies. Yes, like cases that are emergencies, that you know that if you do not do something quickly, you might lose this patient and then also lose the baby for ORG. So those skills, like pick them, and then they put food on your table eventually before you eventually go into residency, for those that want to do residency or get something that will pay you permanently. So maybe during the NYSC year, it could really, fetch you something to feed. And then for enlisting pediatrics, for pediatrics, things like lumbar puncture, things like, setting lines for every rotation, or you should be very good with setting lines in pediatrics. Then that's for pediatrics. The ones that I remember more, I can still, come back to pediatrics. Then surgery, surgery. Then things like, for CTU, passing a chest tube, yes, what you should do in cases of, emergency cases, yes, how to resuscitate the patient who is brought in to you before sending to maybe a tertiary institution to be managed by professionals, or experts in that field. So that's for surgery. And then internal medicine, still skills you do here. Like maybe cannulating a patient for dialysis and endoscopy, but those ones are still things that you would have to do in the tertiary institution. But if you can't get the skills as a house officer, you'll be beautiful. So basically, just apply yourself. Learn anything that can be learned. There is no knowledge that is a waste.
Okay. How do you handle high pressure situations?
I cry if I have to. I cry. I would I cry. I might not cry in public. Like lock myself in and cry, and then relieve some of that pressure, and then sleep, wake up, read novels, lots of novels, and then maybe watch movies. Yeah, watch movies and then read novels, something like that. That would I feel better, and then maybe spend time with friends or friends.
Okay. So, what's the most common mistake interns make?
The most common mistake still goes back to what I said, not willing to apply yourself.
Okay.
I would say that's a mistake because it has to be a mindset. One who has made up their mind to, learn, submit themselves to learning.
Okay.
But those who do not want to or haven't made up their mind about it will just, go through housemanship and then there is nothing to show for it.
Okay.
And then another mistake is financial mistake, but that's another talk for another day.
Okay. Is accommodation provided for you at this hospital?
For me, I do not use the HouseOfficer's accommodation, but there is accommodation provided for HouseOfficer. Although there is a comma to it, but there.
What's this comma? A lot of people have been talking about it.
Well, okay. The accommodation at Grace Court, currently they do not have lights.
Oh.
Yeah, although they've been working on that, but that's the command. Yeah.
Okay.
Although I don't speak it, but that's been a complaint quickly.
Okay.
Yeah.
So what should guide the new doctors in choosing a place for housemanship?
What should guide I feel first of all you have your personal reasons. That you might want to go to a certain place for certain reasons. So if you have that sorted out, you should be looking at a place where you will be able to learn. People run away from places where there is work. But then I feel those are places where you can actually learn. So if there's a way you can manage the workload, then it's fair. You could learn a lot from those places.
What self-care practices do you prioritize?
Sleep, and then eat.
Okay.
Yeah.
How do you maintain relationships outside work?
I would say I try to be intentional. It's difficult because most of us we are adults and we have a lot of things going on for us. Get carried away with work or pursuing one thing or the other. You see yourself forgetting people who you call friends. We might not talk every day, but then once in a while, we just throw in a hi, hello, how are you doing, how's it been, to that friend of yours, and just see or check on that person and make sure that person is okay. Okay, so it just has to do with intentionality.
Okay. Do you have any artistic hobbies?
How would you like to say? Is it an artistic?
It is.
Yeah,
It is.
Makeup, yeah.
Makeup.
I like makeup.
Yeah.
I didn't really pursue that
It's
way
evident.
I should. Well, that would be two things
Okay.
artistic about me.
Okay. What advice would you give to medical students and aspiring medical students?
For aspiring medical students, if you want it, if you really do want it, go for it. And then for medical students, choose what you have to do. It might appear difficult, but actually it's not that hard. If your mates are reading, read with your mates. If your mates are having fun, go out and have fun with your mates. Just don't, be left out. Don't, stray far away from what your mates are doing or what people are doing. And what comes to us, you could just fall in between and then pass. Yes, it must not be, the high flying student, but what comes to us, you pass and just do what your mates are doing.
So what qualities make you a good doctor?
Make me a good doctor.
Yeah.
Am I a good doctor? I know you do, although at times I try to self-evaluate myself because you get carried away at times because you just want to get the hell out of the hospital at times because sometimes the stress is just too much. You just want to do your work and then leave the hospital and then you see yourself, doing things that you never expect you never do while you're like, yeah, no, I'll never do this when I become a doctor, but you see yourself doing that. So I try as much as possible to be compassionate. I'm very intentional about that. I try. Although some patients and patient needs can really get on your nerve, but I try not to lose my compassion. And I try to pay attention to details. Yeah. It might take time, but then even if it's just one patient that I see, let me exhaust all there is to be exhausted on that patient. So it's better 100% one patient than 50-50.
Okay. So if you could, what would you change about healthcare system right now?
I'll start with if I was in a political because that is the only way I will do that. That's the only way because the problem we're currently having in the healthcare system in Nigeria, stems this from what those up there, the policies they implement, the things they do. So if I was in a position where I could change things, I would start with better incentives for health workers, doctors, the nurses, the medical scientists, the pharmacists. People are leaving the country because there are no incentives for the kind of work we do. Yes. If there are incentives, people would stay. Not everybody wants to Japan, but because of the economy and the things that people want to go to a greener pasture where they get money to take care of their bills and their families. So let that incentive be there, and then the hospital should be equipped. Yes. I don't know whether it's something the private sector has been able to, do. But you see most of the patients going down from the hospitals to carry out these investigations like this. CT scan, when a hospital can get a brain CT scan, sorry, brain and CT machine, and then these scans can be carried out in the hospitals to create, more resources for the hospital, create money for the hospital to get. And so I don't know if they're working hand in hand with the hospital, the private sector. So most of these patients have to go outside the private facilities to do the investigation. But then, if I were to be in a political position, I would make sure most of the hospitals have this equipment, and then train personnel to carry out these investigations, and employ more doctors, and make sure these doctors, these nurses, these healthcare and workers are taken care of. At the end of the day, they are like, those who eventually will be envious of those who stay back. It's possible. So they do that.
So, if you were to go back, would you change any experience that got you to where you are right now?
I feel these experiences are what make me who I am. Although there are some experiences you would want to forget. There are experiences you would never want to have again. But in all, there are things that make us better. So,
Okay. So mention one person in your team you admire so much.
currently,
Yeah.
my consultant is an amazing person.
You're who?
My consultant.
Okay.
Well, I like his way of living. When they talk about all those toxic, very friendly consultants, and he's not one of them. It makes the environment very conducive for working and for learning. So I admire that a lot.
Okay. So, are you happy?
Yeah. Yeah, so I have to. I am very intentional about that. I cannot trade my happiness for anything. No. A lot of things would want to take that away. Nigeria would need to want to take that away, but I try as much as possible to be happy, to stay happy. So it's your duty to make yourself happy and to stay happy.
Okay. Thank you. Thank you very much for your time.